So if we take the hype away and the buzz away from AI, because today everybody has AI, from somebody who drives you to somebody who sells sandwiches to schools, kindergartens, and finally colleges and hospitals and industries. In your opinion, or in your particular setting, and if I can get an example from each one of you in those contexts, what is AI meaningfully used, and how is it actually currently used? So the status quo, what's happening?
Yes. Thank you, Dr. Kinda. And I think embracing AI is already on way, and we have seen examples of well-renowned medical schools that have already published updated curricula that have integrated or incorporated elements related to AI. Obviously, the speed at which it's advancing may be a bit of a challenge. Nonetheless, it is now being infused here and there, albeit and we're having this discussion quickly before the start of the session, is maybe it's not in a transformative way yet, because using technology in a transformative way requires very strategic thinking as to where to put it, at which level, for what purpose, and how does it enhance the already existing frameworks and principles of education that we follow, be it competency-based medical education, student-centered, outcome-driven, precision medical education. So I don't think we've reached that stage yet, but we're on the path for that. But that requires not only strategic thinking, as I've already mentioned, but also a lot of experimentation, exploration, collaboration between different schools, so that to optimize the outcome and see what works, that cuts across different contexts, different cultures maybe as well, and data-driven adjustments to see maybe this works here, doesn't work there, to see what fits best, and always reverting to the principles of education, the educational theories that have informed the design and execution of curricula, and not to stray away too much from them just because we want to be so focused on the technology itself.
Thank you. Dr. Kuwaiti, any comments in your context, in the clinical context?
So if I were to look at it from the operation perspective, AI is already in the hospitals. It's already embedded in at certain levels in certain systems, like the electronic medical files and what have you. And our students, when they come to the hospital, they go through the process of knowing the system, and we train them in doing so. We also embedded it in the learning management solution we have for the simulation that we currently have for the medical student. It's support in assessing the patient's evaluation from reading the videos and what have you. And there's also multiple small areas where we actually use it in the hospital that interact with the patient as well. There's a lot of security around that, though. There's a lot of restriction that we have in place. We are trying our best to protect the patient information as well as the employees' information as well. But this is where it gets complicated. We want to embed AI, we want to use it as much as we can, we want to use it, but there's always that restriction that we want to maintain at some level.
Sure.
Yeah.
You want to do it well, and you want to keep it and do it in a sustainable.
And we want to have the cybersecurity around it too.
Of course, absolutely. We'll come back to that as well.
Absolutely.
Thank you. Dr. Vidya, what's happening in your part of the world at M42? You guys are leaders in precision medicine and digitization, data-driven, everything. What's happening?
Yeah. Thank you so much for this important question. So AI has been already incorporated successfully in our clinical education and also in the real life scenario. Especially in M42, we have several AI tools or agents. The first and foremost, I would say AI bedside and bedside to bedside. So it is basically a large language model, which we call Med42, where clinicians can interpret the complex lab reports or polypharmacy and diagnostic charts so that they can make meaningful clinical insights. And especially it helps newly joined clinical workforce where they get more confidence using this Med42 LLM tool. And we also have health record agent. So that is basically collecting all the pre-visits so that, surfacing all the medical records. So whenever our clinician enters, so they're fully informed of the patient history. And we also have the scribe agent. So it is like in real time, catching the conversation between patient and the clinician so that clinician can focus on the patient rather than just typing and documenting it.
Amazing.
And it is very good tool because it is also incorporating into the EMR system. And we also have for the coding agent so that it helps to retrieve the accurate medical code so that it serves or facilitates the billing and correct workflow. So we are using all these tools.
Are they implemented?
Yes, we are using
already
it. Yes,
within your clinical
setup
space.
And in the hospitals. Yes,
That's
they do use all these
fantastic.
tools. Yeah.
And I'm sure we probably can find data in a few years to compare before and after and get more quantitative
Exactly,
information.
the information. Yeah.
Fantastic. Thank you.